Let's start. Good afternoon, everyone. My name is Kaustu Bandyopadhyay, and I'll be your host for today's webinar. I hope that all of you are doing well and keeping safe in this very unprecedented time. But it's a tremendous privilege and pleasure to welcome you on behalf of the PRIA group of families institutions. Today, we are going to discuss the impact of COVID-19 lockdown on urban informals in India. Our focus will be more in India, and as you can see that we have invited some scholars, activists, professionals from various cities who are working with the urban informals for many, many years. So we will hear out them. And we also have some participants from other countries as well. So since the time we first thought about this conversation, um, a lot of things have changed. Unfortunately, many such changes are not in the desirable direction. When we started this conversation amongst our friends, colleagues, we knew that the lockdown will have a deeper negative impact on the informal economy in this country. But obviously, how far, how deep, we really didn't know. And we don't know as yet. Uh, we also knew that people, particularly the migrants, daily wage workers, laborers, living in the high density informal settlements, would find it difficult to maintain the much desired social distancing. We also knew that many of these people were living under fear of uncertainty, of being infected, of hunger and starvation, and death. But what we did not or couldn't anticipate is that people in their desperation would take the risk of returning to their villages and small towns, often on foot, walking thousands of miles, including children and women, refusing to believe their own governments, albeit from their lived experiences. We also couldn't anticipate that these hungry and frightened people will be beaten and humiliated by the state authorities as well as by some of the fellow citizens. We also didn't know that these people will be denied to enter their own villages in fear of contamination. In our invitation, you might have noticed that we have listed three main questions. Let me share those questions. Okay, let me read out since I cannot share these at this moment. Um, uh, so, so, so for the first question that we asked was, what are the added vulnerabilities of these urban informals during and after the COVID-19 lockdown? The second questions that we asked, what the central, state, and local governments can do to address these vulnerabilities of the urban informals. The third questions that we asked was what support the civil society groups, philanthropic institutions, and international organizations can provide to mitigate the long-term effect of lockdown. So I, I don't think that these are the most brilliant questions, but this will help us to structure our discussion today. But our esteemed panelists can any additional questions and we can deal with that. So today we have a terrific panel and none of them actually need an introduction, but just for the benefit of all of us, let me introduce each one of them very briefly. So we have our first speaker, Professor Amitabh Kundu. Professor Kundu is currently the Distinguished Fellow at Research and Information System for Developing Countries, RIS. Until January 2014, he was professor at the Jawaharlal Nehru University in New Delhi. He has served several national and international committees, and he is also in editorial board of Manpower Journal, Urban India, Journal of Educational Planning and Administration, Indian Journal of Labor Economics. He has about 35 books and 300 research articles published in India and abroad to his credit. We have our second panelist, Ms. Sheela Patel, who is the founder director of the Society for Promotion of Area Resource Center, or SPARC. SPARC is based in Mumbai, and Ms. Patel works very closely with the National Slum Dwellers Federation and Mahila Milan, two community-based groups working on the poor, with the poor in Indian cities. She is also founder and chairperson of Slum Dwellers International, a network of community-based organizations spanning across Africa, Asia, Latin America, and the Caribbean. In 2011, Ms. Patel received Padma Shri Award for her outstanding contribution to transformation of the lives of thousands of urban poor in India. We have our third speaker, Dr. Gautam Bhan. Dr. Gautam is the senior lead academic and research at the Indian Institute of Human Settlements based in Bangalore. He teaches, researches, and writes on the politics of urban poverty and inequality, urban and planning theory, housing, and identity and social practice. At IIHS, he has taught under several programs, including the Urban Fellows Program, Urban Practitioners Program. He has been active in several urban social movements on sexuality as well as housing rights. I'm also delighted that the founder president of PRIA, Dr. Rajesh Tandon, is also with us. Dr. Tandon was appointed as the co-chair of the prestigious UNESCO Chair on Community-Based Research and Social Responsibility in Higher Education for 2 terms. First one from 2012 to 2016, and then 2016 to 2020. In 2018, Dr. Tandon was appointed as a member of the subject expert group on curricular reform and educational institution social responsibility under Unnat Bharat Abhijan. So the general plan today is that, first of all 3 panelists will talk to us, and then each of the panelists might take 10-12 minutes, and then we'll open for discussion, inviting questions and comments from the participants. And after the open discussion, I will invite Dr. Tandon to summarize the key takeaways from the discussion. Just a few words on how, as an attendee and participants, you can contribute to the discussion. One is, you must have noticed a Q&A button at the bottom. Please click that button and a dialog box will open. You are allowed to type in your questions, not only questions, but also comments. If this questions is targeted to a particular panelist, please mention it so that that particular panelist can respond to your specific question. Well, you can also vote for a question by clicking up the thumb up sign on the left side of a question. It's almost like, liking on your Facebook. So you can do that. And you can also raise your hand by clicking the hand symbol if you want to talk during the time allocated for question and answer. And we'll try our best to create an opportunity. So that's the kind of general rule of participation in this webinar. So we are almost set, and without taking any more time, let me invite Professor Amitabh Kundu as the first speaker of this seminar today. Professor Kundu.
Thanks, Kaustuv, Rajesh Bhai, and the PRIA family. We are having this webinar at an interesting time. There's a Chinese proverb There's a curse. May you live in interesting times. It's a time when the distinction between precaution and panic is getting blurred, not only in the people's perception, but even in the administrative orders. One is not very sure exactly what lockdown means for people, because on the one hand, you say there is a Lakshman Rekha, you're not supposed to come out of your houses, and then you are told that you have to also take care of 9 persons meal in a day and take care of the neighborhood. In fact, the understanding of what actually lockdown means at the neighborhood level is not clear. People, policemen come in and in fact beat up people if they are walking. At the same time, the medical advice comes from popular and social media that walking with or without a mask is not very dangerous. So one is not really sure how this lockdown is being really perceived at the grassroots level by the people and also those who are implementing it. Now, in this very disturbing time, let me begin with one silver lining. And that is noted, and it's also being mentioned, that the rate of dissemination, the infection in India is somewhat less than what we have seen in China or other European countries or the Middle Eastern countries. And this has been attributed to, some people say it's because of the virus is somewhat less potent here, or the climatic conditions. There are various explanations. But I think one factor that strikes me as extremely important, which creates social distancing even before it was announced, and that is fragmentation of our labor market. The unorganized sector, the schools that send their children to, the hospitals that they go to, the public places that they generally visit, although there is no restriction on their visiting other places, the places that they eat, the localities where they live are somewhat segmented. And I can tell you, if we know that this has come to many of the less developed countries through importation, I think person who is arriving from Europe or Middle East in India, there's a very small percentage who will take the metro, will take a taxi, whereas in European countries, I think 5% of them would just get down from the plane and take a metro. So the possibility of communication tends to be much higher in the European context. And I think perhaps India, this great disparity that we have between formal and the informal sector, fragmentation of the labor market, and much less of interaction has been responsible for the slow spreading in the initial stages. That's my understanding. But I just want to comment on this lockdown which has come up. There is an assumption that lockdown in the cities certainly would mean quarantining of people. That seems to be an absurd assumption, because it is possible for the upper class and the middle class to say, okay, we just don't step out of the house, but we assume that everything else in the system will function, which means some people will have to come out of their houses. And that is really worrying me, that the impact of lockdown is very, very different in the organized colonies and in the unorganized colonies. I can tell you that the middle class and the upper class can certainly create an environment which is less risky for themselves by closing themselves into their houses or in their smaller neighborhoods. But if you look at the statistics of the living conditions in the large cities, and I looked at the data for 4 or 5 states, Maharashtra, Delhi, NCT, West Bengal, Tamil Nadu, and Karnataka, you find that the lockdown certainly would mean for 30% of the people not increasing the social distance, but increasing social proximity. No, we have about 33% of the households in the urban areas. In Mumbai, it's much higher. In Kolkata, it's more or less similar. Something like 40% of the people either live in one room which has a kitchen and just one room with an average number of persons being 5. Now, if the moment you say lockdown, you are not supposed to be moving out, you are really increasing the density factor. And obviously, in the slums and the low income areas, people will move out of their houses. But earlier, if there is no lockdown, the ladies will go out for work in the various service sectors, maybe low productive. The men also will go out. And then density and the level of interaction within the low income household would be much less. But now with the lockdown, the level of interaction goes up because they have to really fend for themselves. You know, lockdown for the middle and the upper class, they can depend on their savings. Their earnings are also not being reduced, excepting perhaps 2 days of salary or maximum 1 month of salary. So you don't have to go out for earning your livelihood. But that's not the case in case of the informal settlements. I can tell you something like 33% of the households in Maharashtra and West Bengal in the urban areas are still dependent for their water supply and sanitation outside their premises, which really means that the lockdown would increase the level of interaction. I believe so far the virus has not reached to that extent in the low income areas, but once it happens, and the lockdown will certainly exacerbate the impact, and the rate of infection would rise very significantly. I just want to mention one more point and then I would come back if it is required. You see, as far as the interstate migrants are concerned, I did a quick calculation on the basis of the data, National Sample Survey 2007-8 and 2011 population census. About 68 million interstate migrants are there, including the family members, of course. And out of those 68 million, 22 million are workers. Now, workers would mean workers in different categories. I tried to find out the number of workers as casual workers who have daily or weekly arrangement for work. That comes to something like 7.5 million. And there are another 7 million people who are getting their salary on a monthly basis, but they are in the informal sector. And these groups are going to be badly affected, despite the great, statements. I think it has come from the highest level. Some people certainly would pay perhaps for a month or a couple of months for the domestic help and the others, but nonetheless, for 3 months of guarantee is not there. People have not perceived. Now, this, as I mentioned, about 15 million people who are interstate migrants. Plus, you add the vendors. About NSS again shows estimate based on that shows another 7 or 8 million. Half of them are interstate migrants. I would think about 16 to 17 million people are in a state other than their place of origin, place of birth, and 24% of these migrants are from Uttar Pradesh, 15% are from Bihar, 6 and 5% are from Madhya Pradesh and Rajasthan. Now, they're in desperate need of going back. Had there been an announcement that, well, after 4 days, there will be a closure, many of them would have perhaps gone back. But still, my estimation is, I'm not very sure about that, that about 15% of them have somehow managed to go in a very, very difficult condition and reach. And the difficulty that they're facing is something that perhaps somebody else can talk about. But I personally believe that once they go back to their small towns and villages in Uttar Pradesh, Bihar, Madhya Pradesh and Rajasthan, it's going to be very, very difficult to control that. So my submission, therefore, would be, as it has been done in the case of Kerala, Delhi has also done it. I think some other states are also doing it. I am perhaps not familiar. They have to see to it that the people are told that there will be no problem in your accommodation, your food, and for at least coming 2 months, there should be no problem in sustenance and also to some extent taking care of the families. Unless this happens, and if there's a massive exodus that takes place from the big cities in these 3 states, as I mentioned, Kerala, Maharashtra, Gujarat, and of course it can include Delhi and Karnataka also. Bangalore is another city where people are going back, and there's high incidence of the cases, positive cases. I think this would be very, very difficult. Finally, one quick comment I wanted to mention. Just comparing the crisis during demonetization and the situation that exists now. During demonetization, there were problems for the unorganized sector. Severely it was affected, but still everybody cooperated with each other, every group cooperated, and because the objective was somehow to get out of this situation for some time until the notes become available. So they entered into informal contract based on the trust, based on relationship. Okay, the paid services will be delivered now, payment will be made later in cash or kind. But now, I think Sheela is in a better position to talk about it. I think the civil vigilante which has come up is certainly doing much damage to the unorganized sector. Anybody coming in the organized colonies from outside for domestic work is being stopped, and certainly everybody is now being a vigilante on the others. Anybody has a green sign in front of their doors saying that you are quarantined, everybody is jeering at them. Northeastern people are also being targets. I have a feeling that the civil society activism needs to be formalized, institutionalized. I do not think the government's capability to deal with this situation alone is tremendous. There has to be involvement of the civil society, even in the rural areas. I'm chairing one NGO, Samarthan, and we have instructed the village local bodies to accept the people who are returning back, but not to keep them in one room, keep them separately to the extent possible. Those who have some kind of a symptom can be kept separately, but I think engagement of the civil society in a manner that this antagonism does not remain is extremely important, and I think that's how we should be in a position to approach this. And total lockdown continuing beyond this period is going to be very, very difficult and will create immense problems for the unorganized sector and interstate migrants. Thank you. I'll stop here.
Thank you, Professor Kundu, for these deep insights. And some of the numbers that you have mentioned are mind-boggling, that so many millions, like 16, 17 millions of migrants, and of which a majority of them are coming from Uttar Pradesh and Bihar, and they are going to be badly affected. They are already affected, and if you have cautioned that if it goes on beyond the 21 days of lockdown, it will have a very severe effect. The other point of this civil vigilantism is definitely a concern, and what we are witnessing most probably a classic class struggle, and we need to keep that in mind. Let me invite our second speaker, Ms. Sheela Patel. Sheela ji, are you ready? I think she's in another conversation, but if I may, Sheela ji, are you ready? Okay. Let me then invite Gautam, Dr. Gautam Bhan, as the second speaker, and when Ms. Patel is ready, then we'll hear from her. Gautam, all is yours.
Yes, sorry, I was muted by the host. Can you hear me now?
Yeah.
Good.
Sorry about that.
So thank you to Priya, Kaustu, to Rajesh. Good to see everyone here. So I'll be brief. So I want to say, take a little bit of a different track and basically talk about the way in which one can think a little bit about practices at this point that come from this diagnosis of inequality. So given our inequality, what are the ways in which that we can do? So I'll focus on 2-3 broad approaches that I think that we should be experimenting with at this time to think about how to deliver towards informal economy workers. Before that, I just want to lay one context that I think is important to think about this framing, which is to say, I think we have to remember that the aim of the lockdown against COVID-19 is to prevent death. Right? The data that we're all looking at is the number of deaths. And I think that the thing we have to understand is that when your ultimate goal is to prevent mortality, then you have to consider both the health-related mortalities that COVID will give you, but as well as the economic-related mortalities that a response to COVID is going to give you. And I think that it is very important for us to equivalently realize that for the set of workers that we are talking about, the proximity to mortality, the risk of death, is equivalent from an economic constraint as it is from a health constraint. And the trade-offs that migrants and everyone who walks hundreds of miles is basically telling you that they are looking at a proximity to mortality on 2 grounds. So we have to understand that terms of lockdown have to understand the trade-offs workers are facing to avoid mortality. I don't think any discussion that says that workers are not aware of the health risks of COVID is foolish and patronizing. I think the question is that they're looking at 2 very hard choices, which is that when they work on daily wage cycles, there are 3 responses they have to think. What will happen at 5 days without new income? What will happen at 2 weeks without new income? And what will happen at 30 days without new income? This is an important cycle that a lockdown plan has to think through. At 5 days, the most vulnerable workers will face hunger. But at 30 days, all workers will need rent. So there are different economic consequences that come for the most vulnerable workers. And we need to think about a lockdown strategy that enables workers to physically distance, not that requires them to physically distance and make choices that they cannot make. So the first thing is to reframe the lockdown as an economic and health lockdown and ask ourselves, what do we need to give to workers at 5 days, at 2 weeks, and at 30 days that will enable them to actually take the behavior that they want to take to protect themselves, not just that we want to impose on them. And I think that the core things we're thinking about here are income, food, and shelter. Those are the 3 things that one requires to survive even a crisis situation. And I think that when you think about income, food, and shelter, one of the sorts that we are coming through is states that had stronger social protection arguments, infrastructures before the epidemic started are going to be able to use those social protection infrastructures to reach a lot of their workers. States that didn't will actually have to innovate and create new delivery mechanisms. And it's the delivery mechanisms I want to talk about. So one thing that I see is heartening in the current response, the state level, not the government of India level, is that many states are explicitly talking about the impact on workers at least. Different states are announcing, for example, UP is announcing 1,000 rupees for daily wage workers. Wage compensations have been announced in different states of the country. We've talked about a government of India order that orders a moratorium on evictions, that orders a rent waiver for a month of April. And I think the tension in these is, by definition, informal worlds are precisely places where instruments of policy and regulation find it difficult to reach, because the definition of a lot of these informal worlds are exactly those that are in tension with regulation. So we need to ask ourselves, what are the ways in which we can actually deliver 1,000 rupees to a daily wage worker? Who is a daily wage worker? Where do you find them? Do they have bank accounts? How much will a direct benefit transfer scheme work? And the problem is that we don't have answers to a lot of these questions, and that they vary deeply in city to city and by sector. So I want to outline 4 ways to think about how to actually deliver the benefits and protections on rent, on hunger, and on income support, the 3 categories I mentioned. How can they be delivered to different types of workers? And I want to suggest 4 approaches. The first is that I think we have to think a little bit about the distinction between whether we can do universal transfers or we work through the sectors of informal work. I think that there is a deep appeal to universal approaches, but I think that we know from our previous experience that universal approaches tend to have particular kinds of gaps in who doesn't access them, and informal employment status is one of the key determinants of that gap. I think it is much better for us to look at sector-based approaches. So for example, Organizations of workers are sectorally specific for most informal economy workers. Construction workers organize in one way, domestic workers organize in a different way, waste pickers have their own federations, street vendors have their own federations. Mass membership groups of informal workers should be the government's ideal delivery partners, more, I think, than universal announcements and pronouncements through the system. Because I don't believe we have the penetration outside PDS, I don't believe we have the penetration at any scale of any other universal mechanism. We are not, for example, like other countries in the global south. South Africa has household level data and household level banking because it already has a universal grant system that covers pretty much all of the country. They can debate what amount of income compensation, hunger compensation should be given. We cannot have that debate. We have to not ask what entitlement should informal workers get. We equally have to ask who's going to deliver them, who's going to find these workers and get the entitlement so that they can actually survive the crisis precisely in a time of lockdown. So my first proposition is to work through the sectors and to work as my second proposition, not just with state institutions, but with informal worker organizations. They exist at scale. They're not nearly at the scales we need them to be, but they are going to be your best bet in combination with government delivery. So I think the question we have to be asking is, if you have a construction workers welfare board with registered construction workers, what percentage of the universe of construction workers do you think that is? And what percentage of the construction workers not registered with the welfare board can be members of unions or other associations of workers? Together, how much of the universe are you covering? Now, Delhi, for example, has 40,000 construction workers registered with the welfare board. They've already got the money in their bank from the government of Delhi. Now, 40,000 is no question a very small percentage of the actual transfer that's required. But I understand the government of Delhi's position. How do they find these workers and do this transfer if they're not registered with the board? This is why we need a multi-institutional strategy of identifying and tracking and delivering these entitlements. And we anyway struggle with these debates in non-pandemic times, that we particularly have to front this discussion in pandemic times. A second approach that I think is useful is to say, okay, we can't actually track the workers through worker organizations. So let's use spatial proxies. So here we get to that question of earlier, which is how much does the spatial informality of living in low-income neighborhoods, like urban slums, like unauthorized colonies, like urban villages, peri-urban neighborhoods, how much do these overlap with also working informally? Now, the more that overlap exists, the more saying, let me be universal within a certain spatial kind of targeting. So I will take all slums in Delhi or Bombay, and I will say all residents of those slums should get income, hunger, and shelter support. And my assumption is that I'm covering a large number of precisely the casual workers that Professor Kundu mentioned, right? So Delhi has, for example, 6% of Delhi's labor force is casual work. Right? Now that 6% is about 2 million people, it's 20 lakh people. You also have a 17 lakh slum population by government standards. That overlap is not coincidental. So the second approach you take is to think about spatial proxies, where the government moves quickly and say, let me target my delivery and cover all these areas and hope that I'm catching all the workers. The third approach I think that's important to take is to think about small loop interventions. Let me say what I mean by this. What I mean by this is, take the example of the rent moratorium. It is easy for us to say that landlords should not evict their tenants and that landlords should give a rent waiver. But 2% of rent agreements in India are registered. 11% of rent in India has a written agreement of any kind. This is true of elite rental as well as informal rental. The moratorium on rent evictions is unenforceable by policy. It's untrackable and unenforceable. What is possible instead? And then the second point I want to make is, for low-income informal renters, the data tells us very clearly that the landlords are only slightly less poor than the renters themselves. These are not elite landlords with large properties. These are also landlords that need support and are likely informal workers. This is particularly true of rent within informal settlements. So when we're thinking about this question, a small loop solution is when we think about a localized solution where a cash transfer for rent can be made from a small local fund to a landlord in order to allow there not to be an eviction or rent-based displacement. You know, on the ground, many people who started walking in Delhi and found themselves at the Delhi-UP border, on the ground, many folks who were there said that people were saying one of our biggest push factors, there are many reasons behind that decision to walk, but one of a really strong pattern of them is pressure from landlords. And the idea that you can nikalo a 2-week lockdown, but no one believes that this is not going to be a story that plays out over the next 3 months. And to survive rent in the absence of income for 3 months is not possible. So small loop solutions try not to go to macro spatial scales, but actually take local economies, circular local economies, and move money within them in order to plug the holes. This can be easily done. One of the models that we use in Delhi, for example, right now is that a lot of citizen associations identify a local ration supply store or a kirana store, which is given a Paytm pre-advance payment, and local families can walk in and against that advance payment draw some supply for ration. These are all small loop local economy solutions that I think have to come up with. The last point, I think, for large macroeconomic responses is I think that the government of India really needs to think about two questions. Some of the surplus and stimulus packages that they are going to announce are going to be ones that target formal enterprises, but they are going to impact informal workers, because those informal workers are going to be connected to the supply chains of those formal industries. For those workers, even a formal sector stimulus package will have tremendous effect. But for workers where in the informal service provider own account worker largely has a buyer that is also themselves an informal service provider. You think of a barber under a tree where the client and the barber are both likely informal workers. Formal sector stimulus packages are not going to reach these workers. And I think that's what's going to become a big challenge for macroeconomic stimulus design, which is to distinguish. We need macroeconomic data, and the national account statistics are partly helpful on this. But a large set of people, home-based workers that are doing, supply chain value adds, eventually that go into a factory. When the factory gets a stimulus, it will work its way down the chain as long as the stimulus comes with certain constraints. But it's not going to happen for informal sector workers that supply to informal sector workers as consumers. And we need to know what that division is at the macro scale. So I'll stop there, because I think one of the things that I'm really what I want to put out, and I can answer more questions, is I think that while we have the diagnosis very clearly that a lockdown cannot mean the same thing in an informal economy as a formal economy, and this has both spatial and economic dimensions, I do want to consistently say that we must begin to understand that economic risk and health risk both cause mortality. Because I think the language that I'm hearing all the time is that in this moment, one has to privilege the health risk during a health epidemic. That is a false framing of a dichotomy if the eventual outcome of our lockdown is to prevent death, which it must be. So we have to think about COVID in relationship to already existing mortality in India on other health conditions. Let's not forget that tuberculosis kills more people in India than COVID has killed globally. And, and to also think about that if we end up protecting the spread of COVID and see a large number of people be pushed into malnutrition and death due to economic lockdown, then we have to ask ourselves whether our ultimate goal of mortality prevention has been achieved and not just a COVID prevention. And I think these are important discussions to have. And I would urge all of us to equally grapple with questions of how to deliver and implement to the existing informal economy. Because without those experiments and innovations right now, even if we announce the excellent stimulus package with all the right entitlements, no informal workers will actually get it. Thank you.
Thank you, Gautam. I think very insightful and pragmatic, a couple of suggestions. You have pointed out the need to work with the mass-based organizations of the urban poor and the informal sector. You have also pointed out that a proxy mechanism would be to work with all the informal settlements with or without any informal organizations. But then also you talked about very interestingly the small loop intervention. And some of the things that at the national level, and perhaps also at the provincial or state government level, some macroeconomic interventions perhaps would in a way mitigate, reduce the kind of risk that we are looking at. Let me now invite Ms. Sheela Patel as the third speaker. Sheela ji.
Thank you, Kaustuv. I was desperately trying to unmute my microphone when I realized that you had to do it for me. So anyway, it's always tough to speak after Amitabh and Gautam and their amazing hold of statistics. but it gives me a very interesting insight into how those processes produce or uh, or prevent local action. Because one of the things that this particular crisis has produced is that unlike curfews that we have dealt with in the last 35 years related to riots, related to crisis of flooding and other things, the difference this time is that even the permitted movement of organized communities who have better ways of managing distribution systems within processes, they are no longer able to go to other neighborhoods and help people. So organizations are restricted by the physical locality within which they work, and this brings to our attention very starkly about the need for local organizations, local associations with good quality data about themselves and the people who live in those neighborhoods to be able to draw in or demand solutions based on who they are and what their problems are. So talking about the issue of migrants, all of us who work in informal settlements know how many single people are living in sublet accommodation in informal areas, how many people are there in construction industry and other places. And yet, and we had a lot of people who appealed to all of us to say, can you help them? How will you help them? And it took the government, and if I can recall, it was the first letter that we saw from a chief minister was from Naveen Patnaik. Amitabh, you forgot Odisha in the states from where migration occurs. We realized that you require state infrastructure and state involvement to address the volume of people in such situations who absolutely have no trust and faith in what the state can do for them. So they are like way below even the slum dwellers or the Juggi residents, because they don't have ration cards, they don't have IDs, they don't have anything which is from the state, in the state where they are. And so I think this particular crisis has demonstrated the need to treat these, we have all been doing studies of migrant labor, what do you do to stop, what does Narega do to stop it and stuff like that. But we haven't understood the implications of the volume of migration that is occurring, and now we are finding that even families are migrating. So what is the implication of that? What we've also realized is that for the first time, our organization, at least with all of us, we're dealing with the networks of district level organizations working in rural areas, where many of the migrants, even within the state, are moving. Because the kind of hostility that those people were facing also requires a response and a strategy of those who have to deal with them coming in. And I think that requires a urban-rural networking capability amongst not only ourselves, but also government. And like Gautam said, the issue is not just of surviving COVID, but also of food. And here comes, and I like this concept of the time frames. What we found is that in neighborhoods that had organizations, had some systems, they immediately would come up with families that require assistance immediately, waiting for others to come later. But where people were not organized, there were like collection riots. So well-wishers who tried to collect grain and go around basically had their workers picked up because they felt that they were creating law and order problems over there. The other thing which is interesting to also know, we said, why did India have less? I think also compared to all the other countries which had a greater amount of cases, India's tourism is much less. And it's one case we should be grateful about, because compared to the number of people who in that period came into the country, ours was much less. And so I think that is there. But I think now we are now seeing cases in informal settlements. And now in Mumbai, for instance, there are, localities we have a map where localities have boundaries. So if you go outside the boundary to get anything, that's not done. One of the things I'd like Gautam and Amitabh to answer is, you spoke about these packages and the fact that informal workers would, of one kind, would benefit from the stimulus package to formal and others don't. I think this is a very important period to recognize the long-term inadequacies of recognition. For instance, everybody talked about soap and water. Everybody talked about hygiene in toilets. These are impossible in informal settlements. So I think that this is very important, especially when we're talking about using spatial ways of dealing with things, which is the only way to deal with densities and mixed households, is to actually create the basis of information gathering at the neighborhood level that allows these kind of things to happen at a regular level, of finding who doesn't have, when there's a crisis, there's a lot of money that is spent. It's all picked up from welfare and other budgets. In Maharashtra, all the MPs, MLAs and corporators are told that their funds can be used for this. There's no tracking. None of us are tracking who's doing what. And the role of elected representatives is also not being discussed. So it could be one thing that we could do. And of course, our real big challenge is that there is no handshake in most cases of what government is doing and what civil society can and should do. And the deep divide within within cities is creating these problems. And so in all the hinterland of large cities, people growing vegetables, having small farms, all of them are just not allowed to come into the city. And there's a very big crisis right now of not only food not coming into the city, but the plight of those small farmers and small dairies and producers who have no way to come to the market. So this crisis is going beyond boundaries of cities, and therefore this constant debate of whether it's urban or rural has to go off in today's world where everything is interconnected. And I think it's important for us to develop together protocols of how all the different state and central ministries have to play a role. The shortages are not because there's nothing available, it's because there is no delivery system, there's no mechanism to do these things. So I think I would prefer to use whatever time there is for questions and to find strategies and to look at ways by which we develop these networks of localities that can share ideas, strategies, and be supportive to each other with the advocacy work that we do. Because I think this is, especially for while all the states are planning different ways to deliver stuff, we all need to have an agreement of how to do things. We're also looking at this idea that Gautam talked about, the small loop of people making registers in their neighborhood to identify which which ration shop to go to, where are their bank accounts, who doesn't have bank accounts, how is the money going to come to them, who should they go and meet if they need it, and then develop a kind of cascading network and maybe radio announcements that will help people to understand. So I'll stop there.
Great. Thank you so much, Shilaji, as usual. Um, let's move to the next round of our discussion, where we hear questions and comments from the attendees. I can see at least two hands raised. Let me first allow. So let me then summon Shubham. Shubham, you can talk.
Yes, sir. Hello. Am I audible, sir?
Yes, clearly.
Sir, thank you. First of all, thank you for organizing this webinar. My question is to Amitabh, sir. Sir, he pointed out that there are around 16 to 17 million migrant workers, right? So, I was just saying that don't you think this is an opportunity to look into this? Like we have 16 to 17 million migrant workers, interstate migrant workers. So this is an opportunity to create employment opportunity and other job opportunities in the state itself, so that workers do not need to migrate to other states, which will also release pressure from resources like water and food and other resources. In the people are migrating to Delhi or Bangalore or Hyderabad or Chennai, and pressure is also created on resources. So if they stay in their hometown, in the state itself, and opportunities get created, so this will also make them feel safe to be happy with, because they will stay with their family members and will also earn livelihood for them. So I feel this is an opportunity to look in that way also.
Okay, let's pick up a couple of questions, and then we can ask the panelists to respond. Manvita, you can talk.
Am I audible? Hi.
Yes.
Manvita here. Right. Thanks, Kaustuv and Priya, for this wonderful opportunity to have this interaction. I think it's extremely important that we discuss and talk about these things. My question is to Gautam. Gautam, there are more than 40 lakh SHG groups formed under National Urban Livelihoods Mission. Do you see a role for them? And I've realized that, and we've been working with them, and they have been helpful, but they also face difficulties working with the city administration. So I'd like to really know from you, and possibly Amitabhji, if you can also pitch in on this aspect, we can discuss, because NRLM is a big success. NULM has not been picked up so well, but your thoughts would be really helpful.
Okay, let us take another question, Venkata Ravi Prasad. Mr. Prasad? Okay.
So there are also a few questions on the Q&A for...
Let's take the live round, and then we'll take Q&A and also a couple of questions on YouTube. Parul Sheth. Parul? Hi, Parul.
Yes, can you hear me?
We can hear you.
Okay, so usually when we think about the unorganized labor, we usually think about the adults, unorganized casual labor. But because we work with children, we in urban areas, we realize that the issue of child labor, child trafficking, etc., can also boost up very high Because when the parents don't earn enough, and when they have lot of financial economic crisis, then they push their children to work, and the trafficking also increases at such point. So how can we prevent such things, or what are the things that we can do to prevent child labor and child trafficking?
Okay, one more question from Sophia.
So I have a very general question actually. So now we are talking. Can you hear me, sir?
Yes, we can hear you.
So now we are in the situation where, like, I'm work with an organization where we are planning for distribution to the urban areas as well. Can we have some kind of guidelines and standards for the people who are going out and distributing? We understand the urban setting, the density of the urban areas. But if we as a group can have some kind of guidelines and standards for the protection of the people who are going to help these people, who are going to the field, if we can have some, do we have that? Or are we planning to think about the protection of people who are going to help them?
Okay, so let's attend these 4 questions first, and then we can come back to the next round. We'll take Sheelaji. And there was a direct question to Gautam and also to Professor Amitabh Kundu.
Do you want me to start?
Yeah, Gautam.
So, on the question of the SHG groups, I think that we actually, unfortunately, this question of what local community organization or form can work, in an emergency pandemic situation, we're not going to have the luxury to actually try and think theoretically about the strongest or not. This is the kind of place actually where a lot of capacity is going to be built in groups right as they are working, not the people who already had the capacity before. We don't have that choice. I think where, for example, in Kerala, because of Kudumbushri, you have very strong localized groups. So like Sheela was saying, we note the differences in settlements. We know where long-standing community organizations exist and where they don't. I think we need to work with people who in different city regions and different states and different rural regions have a map of the area and understand the nature of community organization. Where it's strong, you trust the communities, you let it be. Where it's weak, you try and activate and use everything that you've got. I think the question is to understand the importance of mapping existing community organizations and then saying, okay, I have work organizations here, I have settlement-based organizations here, I have federations here, activate all of them. And I think that's the only way to do it. I think for that to happen, what you need is a strong signal from the government, whether it's city or state or center, for that appropriate scale, to send a signal out to communities that they want their partnership. I think one of the biggest things that we're not yet hearing, right now, for example, in informal settlements across Indian cities, there is a deep that should there be any infection that anyone declares, they will be sealed off, barricaded, isolated, and left out. They need to be told, actually, that the voluntary disclosure of symptoms will be met with a response of dignified quarantine and economic compensation. They don't need to be told that any disclosure will endanger them. So we need to first send a signal out that communities are welcome as partners, and we will work with them to find out. Community groups have the solutions of what works locally in their areas. They have the knowledge. We need to reach out and ask them, tell us what to do. We don't need to sort of activate them. I think that's the approach that I'm advocating, that we shift a little bit. If this government sends out a message, if city government sends out a message saying, all community groups, tell us what you want us to do in your areas, we want you to be our partners, they will put 20 solutions on the table. For example, many informal settlements I know with can figure out a medically safe in-settlement quarantine facility inside the informal settlement itself. Those local solutions are possible as long as they are asked. And I think the example, if you'd like to read more about this, there's very good public writing on the way Ebola pandemic responses in Africa had a specific policy for informal settlements. And it was all about community leadership and voluntary disclosure. and preventing isolation and spatial caging. And I think that the Ebola response to informal settlements in Africa must guide us here as well. And I think that's a strength. But I completely agree with you that urban community mobilization on the government side is weaker than the rural. And this is where we are. And it goes back to the lessons we have to learn about the importance of building these structures well and trusting communities before the pandemic. We can't just ask them to come to or after the pandemic and never want their partnership. Sorry, on the question on the helping workers that go to the field, I can't think of anything more that is more important and more neglected right now. I mean, this is the fight that we have constantly. We don't have PPE for healthcare workers in hospitals, let alone the right protective equipment for frontline workers in sanitation and in delivery. So this is the question everybody should be asking, but the central government has decided to, in large parts, control the production and manufacturing of this. So some signal from Delhi will have to come. And I think as citizens, we need to really make noise on the PPE question and open up decentralized manufacturing and distribution on a crisis.
Thanks, Gautam. Sheela ji.
I want to respond to, Mandita, one of the real failures in cities has been the lack of ownership by elected representatives, civic administrators and mayors. And in all the work that we are doing as SDI, we're putting out a campaign that says the mayors have to be the champions of the vulnerable. So like Gautam says, there has to be a signal from an institution of the state that people can recognize, who give out messages, who roll out support, who listen to what localities are saying. I mean, we have an amazing infrastructure of elected representatives. We are not holding them accountable for their lack of action, their lack of knowledge, their lack of ability to pressurize the legislature or the corporation to do things. And I think this concept of organizing to make noise, lots of people writing to their MPs, MLAs, to everybody to say, what are you doing? Put out in your local radio station, talk about who's doing what. There is no demand that is coming out. Most of us are struggling to cope with whatever we feel we can do. And I think this kind of crisis tells us that we have to deal with people who are different, We aggregate as urban groups. Suddenly you realize you have such a big network of urban-rural networks that have to work together. You have to activate them. Half the time we are fighting about whether this type of strategy, in the data world, all of us are saying poor communities have the right to own the data of their neighborhoods and they have a right to aggregate it to the extent. What is the government doing? It's doing all this satellite mapping and all this electronic stuff, which poor people never have an access to. This is the time when these things have to be pushed forward, because they have huge implications for the next 2 stages of recovery that we are talking about. The other thing which was this question about migrants. I am amazed at how much we do not understand the way in which migration in today's economic order is going to grow regardless of all our aspirations to keep people standing where they were born. And I think the real crisis today is that we don't have enough demographers and economists talking about how economies are moving people, all economic investments are moving people. So, this thing of saying, why should migrants grow? People have tried to keep people in rural areas for the last 40 years. It hasn't worked. So the question is, there used to be a very old thing called the Migrant Workers Act, which was very, very, very cumbersome, where the collector was supposed to know everybody who migrated out, would give that note to the migrants who were coming in, and there was supposed to be protection. I don't think anybody's looked at something, but we need to explore ways by which interstate migrants or even migrants within the state have some legitimacy and status. And I think we have to work towards that. There will be some areas in which good quality farming, improved water supply will change practices. But the reality is that urbanization is transforming where people are staying. So we need to look at that very carefully. And Parul, your thing about working children, I think is something, these are all hidden things that nobody's talking about. We need to understand this more. We're also hearing from a lot of women's groups that domestic violence has already spiked up in homes where women were the main workers who are now sitting at home and not sure whether they're getting any money. And we need to figure out, we are finding this in many of the locations where we are working, but I don't think we have a clear data of how widespread that is. But I think this issue of aggregation of data and looking at ways by which it can serve different objectives, I think is very critical. And we've got to look at ways by which it doesn't only happen in places where people are organized. And all of us as NGOs have a limited capacity of what percentage of the population we can do that. So we've got to work with municipalities to do this.
Thank you. Thank you, Sheelaji. Professor Kundu?
Kaustuv, I think there are two very important propositions at the ground level. Portions have not been understood by the people and also by the implementing agency. I think Sheela talked about it and also the questions. I think there's general feeling that all that the people of the country can do to help the government and fight the COVID-19 menace is in 21 days, or if you stay at home, there is no.
We can't hear Amitabh at all.
Let me stop your video, and if it improves your audio. Professor Kundu? Okay, we'll come back to Professor Kundu in a moment. There are a couple of more questions, but I would also encourage the panelists to look at the question and answer dialog box. And
where is that?
If you press Q&A, that will appear.
Q&A.
Yeah.
Okay. Yeah. Okay.
At the bottom.
So do you want us to type the answers there or to?
Well, no. You can pick up of your choice. Any question, any comments. If you want to respond to the participants, that would be fine. But let me invite Banasri to make her comment. Banasri.
Hello.
Yes.
Can you hear me?
Yes, we can hear you.
Well, first of all, Kaustuv, yeah, it's great that you organized this interaction. And actually, in answering the questions, both Sheela and Gautam, they sort of took on some of the points that I was going to make in the questions. But I think what is implicit in what both of them said is that it's really the state that has to learn a lot in terms of information and communication that it passes on to citizens. And to create that kind of faith that things are going to be okay. So the question is, who's going to do that? And how does this get triggered? That's one thing. The second thing that I have is that, again, it's from both of them, what I could understand is it's again a weakness of the state to be able to work with organizations of the poor that know who know what's out there on the ground and who can make a difference. So where is the trigger for change here? Do we know places, maybe some districts, some cities, where this it's beginning to happen, or can we share some good examples? The third thing that I was going to talk about is Ebola, which again Gautam has taken on. And when this COVID lockdown and everything started in different countries, in the African countries which were afflicted with Ebola, they had their systems in order, and they already got their community surveillance and everything going. So I think there's a big, big lesson to learn from that, and that is something where which has to be communicated to decision makers. That have a look at what people, these countries did for Ebola, and let's move on. Thank you.
Yes. Can I also take Giri-san?
Good evening, sir. Thank you for organizing a webinar. In fact, I have now a specific question, but I would like to make a comment. I think there is a policy gap in addressing disaster risk management, because when we closely analyze the national policy as well as the available state policies, there is no specific role given to the local governments and community-based organizations. I think both Mr. Gautam and Madam Sheela highlighted that point. I think that's what I am seriously looking for. I think there is a serious policy gap with not giving adequate space or responsibility to local governments and CBOs. Thank you.
Okay. Srinivas. Srinivas Rao.
Hello, Kaustu, can you hear me?
Yes, Srinivas, go ahead.
Yeah, so my question is, there is a huge amount of invisibilization of informal workers. I mean, currently the estimate says that we have close to 450 million informal workers, and another estimates, which is, I don't know. So what is the way of actually, somewhere if you don't even know who they are, how will we, or in any government or any institution will reach out in such a time? And also, is there any estimate on job losses? Is there any way of figuring it out also, that out of these, how many job losses have happened in period of say 21 days, or is going to happen due to the economic downturn that is going to hit us anyway? So what is, I would really like to hear from Professor Kundu. Is there any estimation, NSSO or any kind of database available in this country to look at that, so that one can respond to these kinds of situation that will come in coming days, post lockdown and all that?
Thanks, Srinivas. Can I also allow Manish? Manish Thakre.
Hello.
Yes, Manish.
Yeah, am I audible?
Yes, clearly.
So I think I have two questions. One is, I agree with Dr. Bhan that what our country is facing is not only a health crisis, but it's an economic crisis. So understanding there are plethora of issues we are facing for last 30 days, and it has actually started. Some of the lockdown has already started, but the PM has announced on 24th or 25th. So my worry is that understanding the next 6 months, how the COVID outbreak will, this entire cloud will open up. So how do we have some activities in order to continue our economic slide, to contain the economic slide down? For example, do we have some, highway projects, or do we have, we can procure the produce from the farmer and continue with some activities? Because the situation is going to be, if it is like this for another 3 months, then not only the informal sector, but those who are living just above the poverty line, they also fall into the trap, and then slowly the low middle income and the middle income. So my worry is that. And second question is related to the pregnant women and the children who are, living in these informal settlements or of the migrant workers. What about their routine immunization and health services? Thank you very much.
Okay, let me invite my colleague, Dr. Anshuman Karol. Anshuman, you have been working in Jhansi, Ajmer, Muzaffarpur with the informal settlements and the informal workers in these three cities as part of PRIA's project. Could you share a couple of insights? What are you hearing? What are you, how are they coping? Any insights from these cities? Because many a times our focus is on the larger cities like Delhi, Mumbai, Bangalore, Calcutta, and Chennai. But these are medium-sized cities. And what kind of situation are you observing there?
Yeah, thank you, sir. Basically, we are working in these three cities, and we are working closely with the urban poor in these three cities in 250 informal settlements. So there's a large part of these informal settlement dwellers are actually informal workers, and most of them, like 40 to 50% of them, are actually daily wage earners, and they are also going through the similar kind of anxiety and they're not sure about their future. They are not actually able to get the supplies and all. So what we have created a mechanism in these three cities. We have we have settlement improvement committees in all these informal settlements, and then we have a city level SIC federation and city level citizen forum also. They are trying their best to work hand in hand, and they are trying to provide all the especially the ration and the food items to the most vulnerable households within these informal settlements. But the larger question is basically what Dr. Bhan and Sheela ji has also raised, is about the availability of information around data. So data is a big thing, and fortunately we have we did almost a census survey while we are working in these settlements. And now the biggest question is, whatever announcements we are making, whether the central governments are making or the state governments are making, in these informal settlements, for example, we have covered almost 28,000 households through our census survey, and varying from city to city, but almost 60 to 70% of these households have APL cards, not BPL or Antyodaya ration cards, and almost 10 to 15% of these informal settlement dwellers don't have any kind of ration cards. So how they're going to get all the benefits they want? And the other question is basically we are quite a bit lucky in that as I mentioned, with that we have the citizen forums and SIC forums. Those are working with their elected representatives within these settlements and within the settlements within the wards. But this engagement of civil society and elected representatives and the municipalities is a important thing. I think these are the learnings we can draw from post COVID-19 this thing. And another thing is, which is not very much happening within these cities, is about the migration. Migration is happening mostly from the economic centers or the larger cities. But whether the municipalities or even the gram panchayats from where these migrant workers are coming, are they maintaining the records? Are they verifying where they are going, whether they are getting all the entitlements and all? And the most important question is how to reduce the informalities. So informalities, not in terms of work they are doing, how to engage them into the formal kind of whatever unions or formal kind of system, but also how we can link them to various entitlements and this thing. Because even in Delhi, if you look at this is my worry also. Like yesterday, CM has announced that all the auto rickshaw drivers, all the rickshaw pullers, and all will get like 5,000 or something in their bank accounts for a month. But in Delhi, if you look at the kind of registered autos and the kind of autos, those who are actually running in Delhi, so it is very difficult unless we maintain that kind of data. We can actually work in tandem with the municipalities. We are working closely with the civil societies. It is very difficult to deal with such kind of situations, and this is a big learning for us for the future also.
Thank you. Thank
So
you.
can I come in?
Amitabh Kundu. Yes, Amitabh we take two more questions, and if you could recall some of the questions that you have to answer now, and you can also take a couple of more questions. I'll come back to you in 2 minutes.
Okay, fine.
Martha Chen. Martha? Hello, Martha.
Hi, Marty.
Okay, let's go to Mr. Gopinath Radhakrishnan.
Hello, this is Marty Chen.
Oh, Martha, please. Hi, Marty.
Okay. Hi. It's such a pleasure to share this seminar and hear old friends. And I just wanted to pick up on 2-3 points that have been raised. One is this role of the member organizations of the poor. And we should see them both as a source of data during this crisis, but also as a channel for transferring the funds and targeting interventions. And I just want to share what I think is really important in a crisis like this, is to highlight that these workers provide the essential goods and services that the whole society and the economy needs. And they could be helped and supported as frontline workers. And just 3 ideas: the home-based workers who stitch garments are already being deployed to make masks and hospital gowns. The waste pickers can be recognized along with the Safai workers to help with sanitation. And the street vendors should be seen as the distributors of food. And this brings me to the focus on the food chain. I think what is being allowed in the food chain is the formal part, which is the wholesale markets and the retail stores. But the informal production side, the farmers and the milk producers, are suffering and not being allowed to bring their goods to market. And then the street vendors, who are the ones who sell most of the food that the poor buy, are on the front line of the delivery system. And I think we need to think through the food chain, and that might be the most immediate response to involve the informal workforce. Anyway, it's a great pleasure, and also that I'll get to hear Rajesh Tandon, an old-time friend. Thank you so much.
Thank you, Martha. Mr. Gopinath?
Yeah, hello.
Yeah,
am I audible?
Yes.
Yeah, this is about that non-notified slum dwellers. So, people residing in that notified slum, they may have some assured access of public services, particularly drinking water and water for other uses. But people in that roadside settlements and the non-notified slums, they are in a severe crisis in meeting their regular this water requirement, all those things. I particularly ask Mr. Amitabh Kundu about the impact of this kind of lockdown on those kind of people. We are talking more about the migrants, but even the people, lot of people are residing within the urban area. They are in the non-notified slums. So public services deliver to these people is a major challenge.
Thank you.
This is my concern. Okay.
Thank you. Okay, let's go back to the panelist, and this time we can start with Professor Kundu. Professor.
Thank you, Kaustu.
Yeah.
I seem to be most technologically challenged at this end, but let me state once again that to believe that the most patriotic thing to do at this time is to just stay at home and then everything will be delivered through drones or I don't know what. That is the most absurd assumption. I believe if you want to have even your essential services being delivered, you do need not only the medical personnel and the media personnel, you need a large section of the unorganized workers to do loading, unloading, for their traveling to from their places of residence to the places of work. And if you have lockdown, on the one hand, we have seen police being brutal in dealing with these informal workers when they're walking on the road, even within the city or between two cities. On the other hand, you have seen thousands of people getting together at a bus terminal or because of the mismanagement. I entirely agree that the state on its own, if it tries to deliver, it's an absurd proposition. There has to be some significant engagement of the community groups, civil society organizations, and we do hear at the highest level saying, yes, you have to take care of the people of your neighborhood. I agree with Sheela that, the basic problem is of organizing the delivery system of the essentials at the moment and also delivery of the purchasing power to the different segments of population. And I personally believe, as Gautam was talking about, instead of having a spatial approach, there would be overlapping and there will be many poor residing in the non-poor areas. I think sectoral approach would be better. We have to work out the logistics so that the relationship of the workers with the employer do not get broken in this period. There can be some part of the money coming from the state, and we can also ensure that some part of the money comes from the employer so that the relationship is maintained. But let me just emphasize this point of getting the civil society, because a large number of people would like to really come out and help. But how do they do that? You can't just go out and identify the poor on your own. There are safety concerns for yourself, and also there is safety concern for the people that you are interacting with. I know in the rural context, Samarthan, Rajesh Bhai has been associated with Samarthan. We had our last meeting, and we were thinking if the civil society in the rural areas try to get into health and delivery of the cooked food, there can be problems of safety of our own people, because this PPE is not available to them, and what they deliver, if something goes wrong, some people get affected, there will be problems there. So I think that the state, the best thing they should do immediately is to work out a framework in which the civil society can participate in a safe manner, safety to themselves and also safety for the people with whom they are interacting. That is my first concern. The second thing, I am to have a total closure of the movement of the people within the city is creating hell of a problem for the unorganized sector. Those who have cars, they are able to travel. There has to be some safe way of taking people in a manner which may be slightly more expensive, but to subject the unorganized sector people to do this kind of a order's journey and face the harassment of the police is certainly not desirable. And I also believe that the state can organize transport system from the large cities, 5 or 6 large cities where the incidence of the COVID-19 has been large, to take people out in the next 3 to 4 weeks to the places of their origin, to the states of their origin, and engagement of the civil society in a manner which is safe for the people, the participants, and also the people whom we are trying to help. That needs to be answered, because I do not see any way that state on its own, without engaging the civil society in a safe manner, can really deal with this problem. And as far as the data are concerned, I can only tell you that we have information from 2007-8, we have information from 2011, what employment data is available or from this 2017-18. I have made some projection of the total migrants, interstate migrants, their employment structure, that certainly that can go into the national level policy of intervention for the next 3 to 4 months as far as provision of employment and sustenance is concerned. But engagement of civil society in the area of health and provision of cooked food would have to be considered seriously, because there are issues of health concern for both the people who are engaged in it and also the people that we are trying to target. Thank you very much.
Thank you, Amitabh. Gautam, you must have read some of the questions, but also hard questions and comments. So you take 2-3 minutes. You take 2-3 minutes.
Yes. Can you hear me?
Yes.
So I wrote my replies to many of the questions in the Q&A box, so I won't repeat those. And so 2 things I want to pick up is the question of, what can keep going in the lockdown? And I think I'll just pick up this thread in my given. I think that one of the things we have to think intelligently about is to take Marty's suggestion that one has to understand that many of the essential services that we are already allowing in the lockdown are run by informal workers. And I think that many of the localized services that can make the lockdown sustainable in different forms is if we support and encourage these workers and also use that as a certain form of income and livelihood protection. So I think we have to think quite carefully about what infrastructures will allow, for example, a localized food street vending, to think about hunger and food support in small communities, because many of these workers are residents in those communities. I think Professor Kundu is right about interstate transport. I think there is no way getting around a certain amount of regulated movement. And I would only say that we do have to, one quick way for folks to assess this is to simply compare the lockdown conditions in 8 of the leading countries in the world right now that are in a 21-day lockdown. And what you will find is that India's lockdown conditions are by far the harshest. And I think that there is something we have to think a little bit about what it means for us to have done that. And I think it basically comes from the fact that we don't trust our fellow citizens to actually behave. And therefore, we think that the most punitive and the most, strict the lockdown, the better. But what we've done right now is declare a total lockdown and then exempt services one by one. And the sanitary napkins is a very good example of this. It was only put on the essential service good 3 days ago. So I think we have to reverse this. We have to first choose the essential services we want and then begin to close everything else. Not close everything and then exempt things one by one. We can't do this in a post-facto regressive way. So let's have a real discussion as 15th April comes around and say what are the 15 or 20 essential services, which of them are essential for epidemic management, and I would add which of them are essential for a degree of economic and employment support for the most vulnerable. Those are the essential services we have to let through, not just hospital healthcare. And then I think that's a way to combine some of these questions of what one must begin to relax, because we cannot continue like this for as long as we may have to continue. I'm actually quite certain that our spread and our disease rates are much, much higher than any of our data is telling us, because we have the lowest testing rates in the world. So I'm not as optimistic as some of the other panelists in thinking about where we are. I don't see any reason to be, actually. So I think we must prepare for much worse.
Thank you, Gautam. Sheela? Sheela-ji? Can you hear us?
I think, Gautam, none of us are very, we're all very pessimistic, I should say. I think that that one of the reasons why these lockdowns are so punitive, it's also related to the curfew culture that has begun. Today I was reading something which was saying, in Kashmir people have learned to survive curfews. I mean, what are we saying? Is that what we want everybody in the country to have, and we should applaud it? I mean, that's so the imageries of what city governments do, what police do, what the army does. These are not seen as supportive, helpful, proactive, trustworthy institutions. They are seen as institutions to be feared, systems to be feared, and a lot of the rioting with the police is emerging out of very bad management of crowd control, which police know how to do lathi charge. They don't know how to do negotiations. So I think that Gautam, this thing that you raised about learning from what other countries are doing, what I think is a very important thing for all of us to pick up and weigh as to what are good practices, what are bad practices, what are state institutions doing which are proactive and positive, and that examples from outside are very, very crucial. So I think that as one of the follow-ups to all this, those of us who know of what's happening in other countries, or even the sequencing of how the lockdown occurred. I remember when I spoke about the lockdown to other country groups in SDI, they came back and said, oh, 3 days ago when you talked about it, we said, oh, that's happening in India. And now it's happening in all our countries. And so people started checking out, you had 2 weeks, what did you have a problem with? What are the federation networks doing? So I think that these are global phenomena, and we have to look at what is happening elsewhere and how, and I think nobody's talked about fake news. One of the biggest challenges in informal settlements has been to separate fake news and all solutions to avoid the COVID virus that are going around in different chat groups. And one of the biggest challenges all of us have had is to separate these from each other. I haven't been able to go to the YouTube one, so I don't know how to do that, Kaustuv.
That's okay. That's okay.
Okay.
So, thank you, Sheelaji. Dr. Tandon, you have heard all these discussion, 2-3 remarkable presentations and some of the insightful comments from the participants. So if I may ask you that what are the 3-4 key takeaways, what will be those?
Thank you all. Thank you, Professor Kundu, Gautam, Sheela, and all of you. I missed a bit of that because there was a sudden power cut in our locality, and my screen went book for a while. So I missed a later part of the conversation. I heard Marty, and hello Marty if you are still there, and others of you. I have been watching the CNN and BBC for last 15 days, in addition to Doordarshan and NDTV and other. And every time I watch CNN or BBC about what's happening in America, I hear the mayor of New York City and the governor of the state of New York. I don't hear mayor of any city in India. I don't even know who the mayor of Mumbai is or who the mayor of South Delhi Municipal Corporation is. What this indicates to me is what our panelists have said. The front line of our work, both prevention and development, has to be local government. And even though our rural panchayats have not been adequately empowered, our urban municipalities and nagarpalikas have been substantially disempowered since 74th Amendment. And every scheme of the government from national level, the shining example being Smart City, continues to disempower them. If local bodies and our elected representatives, they run into several 100,000, each city has 100, 200 councillors. Small cities have 2. if they are not at the front end of acting at this moment, then we can never think of dealing with or even preventing such crises. And related issue is what many of you have said, is the issue of data. Local data, granular data, community owned data is the only way to acknowledge and recognize informality. Informality in our urban spaces, informality in India's economy, informality in India's agriculture is here to stay, whether we like it or not. And if we don't acknowledge it in our policy making, we will never come to terms with it. What the disaster has shown to us is that our systems of planning and policy making are focused on the formal, and you actually cannot reach informality through the frameworks and logics of formal that we have inherited and that we practice. You want to reach informal communities and informal habitations and informal sector workers, you have to use informal channels, my friends. And those informal channels, we have heard, are informal associations of the urban poor, informal community-based organizations, informal channels of local civil society groups, informal channels of local kirana stores or local, even the, if we want to reach them, even in this crisis today, we have to reach them through informal. We cannot reach them only through formally designed institutions, which by definition are incompetent to deal with informality because they don't understand. And this is where I think at this moment of the crisis, which I share the analysis of some of you, we are in it for not just 1 or 2 months, we are in it in the long haul. And therefore, we need to figure out how informality needs to be addressed. The last point, what I picked up, all our panelists have said this, and I've been feeling like this. We have to trust people. We have to trust urban poor. We have to trust informal workers. We have to trust their associations. We have to trust local civil society. We have to give them the feeling that they can lead it, and we have to give them the resources and the support. Please, one non-performing asset worth 50,000 crores can at least be allocated to the not so trustworthy urban poor to deal with this crisis. Because we only look at formal systems, we trust formal systems which fail us all the time. So my suggestion is, and my takeaway is, we must trust urban poor, their associations, howsoever informal they may be, and we must trust informal channels and put resources in their hands. Even if a special approach, as Gautam was saying, or that NSDF does in Mumbai, even if going through a habitation of 100,000 people, if 20,000 of them are not so poor, you give everybody the resources. Please let them deal with it. The poor themselves know who can benefit more than the rest. So this is the problem. This is the problem. I am looking at all the 11 groups that have been formed by the central government. All of them comprise of IAS officers. They are not equipped, my friend. They are not equipped to understand or deal with informality, crisis or not. And in 2012-13, PRIA and some others did a study. Professor Kundu knows about it. Sheela knows about it, about the contribution of informal sector, informal habitation, informal settlement to cities' economy. At that time, it was almost like 10-12%. And if we don't see the economic contribution of the urban poor, then we don't trust them. And if we don't trust them, we will never be able to support them. My takeaway are these. My takeaway is not about problem of migration or problem of density. a country of our size will, those are not problems, those are realities. And if we trust them, if we use informal channels to address informal workers. The trade unions, the labor ministry of this country has been completely defunct. The trade unions have become weak. So the associations of the workers in the informal sector themselves have definition: invisible, small and informal. So where Ministry of Labor doesn't actually exist anymore. So if you want to talk about informal workers, we'll have to look at these mechanisms. Trust them, use informal channels, focus on local government, strengthen them. This is not only for 3 months, this is for years to come. And thank you. Thank you, Kaustuv.
Thank you so much, Dr. Tandon and all the panelists. We have almost come to an end of this webinar. I'm sure that all of you have picked up your own learning and action agenda from this conversation. I have also taken my own notes. But just to sort of conclude, the last point that Dr. Tandon has mentioned, and if I may call it the governance of informality, that needs to be looked at, and how we make the local governance institutions as one of the most critical actors, and how to empower them to deal with such crises, whether today it is a health crisis or it's economic crisis, but there could be many other disaster or crisis situations. But if we don't empower and strengthen the local institutions, we are not going to overcome them. And the second point is, and I think all the panelists and Dr. Tandon has also emphasized the need for strengthening the community-based organization. And in some way, I think Sheela has mentioned that it's not only the local organizations, but how do we help them to connect to other local organizations. So it's a kind of network of community-based organizations, either at the city level or even larger, urban agglomeration level. We need to think about how we strengthen the granular level organization, but at the same time we connect them with other organizations. So it was wonderful to listen to all the three panelists and Dr. Tandon, and also listen to some of your questions and comments. As a kind of next step, I think we should continue this conversation, and as suggested by Gautam and others, that perhaps it would be good to organize one such conversation, inviting some of our international colleagues who are working in other informal settings to hear and understand how they are coping up with that. So it's not only the crisis is a global crisis, and therefore it has to be a global conversation as well. And what we'll do, we'll prepare a note from this conversation and circulate around. You are free to use that document for your own work, and to share with other networks that you belong to. And thank you so much. Let us conclude this conversation here today with a hope that we continue this conversation in future. Thank you so much.